And when it comes to handling, time from collection to testing is analyte integrity, which means you have to maintain it. There shouldn't be leaking. If there's leaking, it means there is something crack. There is some hole there. There's something where the outside components can enter and can alter the result. So you have to be very, very clear about the integrity. If it is broken tube, if it's a leaking tube, if something is messed up, if the cap has opened or it's broken, you have to check. Does the lab have the ability to test immediately? Yes, majority of the labs they have. Or does it have to be sent out to reference lab? Only few of them they send it. What does the reference lab means? Reference lab is a lab where, for example, Life Lab is testing something. They are getting a result. And now they want to make sure that if their analyzers are working correctly, what they will do, they will have communication or contact with the other competitive labs. They will send there as a reference lab to make sure if they have the same analyzer, is this result good? Is it the same that they are getting? If they're getting the same, it means it's fine. If they're getting different, erroneous results, which means a huge difference is there, they cannot do further testing or something. They have to stop it, call the head office. Then a technician has to come and he'll be from the manufacturer and they will come and fix, and then they have to sort out and they find the issue. Or if that lab is not happy with it, they have to do the same. That's how the whole medical labs are functioning. Even though they are competitors, they have reference connection because this is how the work is maintained. When it comes to medical field, there is no yours or mine or hers or his. No, it's common. Why? It's a teamwork. It's a teamwork. It has to be maintained because for the cause of the wellness of the public. Yes, Azinath, go ahead.
So, in other words, is it like a second opinion to make
Second
sure
opinion.
that?
Yes, they
Okay.
have to do that as a policy. All the labs do that.
What's the
You will
quality control?
learn this. This is a thing that the labs have to do because to maintain the quality assurance, they want to make sure they are giving the quality results. They are assuring the public, we are there for you. We are doing all these things to maintain the what do you call the quality of the test results. So no one can
Or
be.
yes, ma'am.
Yes.
Or they confirmatory, meaning that it's really positive. For
Yeah.
example, HIV.
So all these things.
Yeah.
No, that is. I'm not talking only from the point of test, from the point of working analyzers. You cannot run the sample if there is anything wrong because the samples are definitely going to show the false results. For 200 patients, if one day if it's showing the false results, the 200 patients results will be going to the doctor. Now the doctor will call and then if there's something is positive, that may become negative. If something is negative, that will be made positive. So who will be affected? The population, us. We don't want that to happen. Okay, so that's why we want to make sure we give the quality results. This comes under the topic quality assurance, and once again, it's a huge topic in when you learn the math in future. Is there a finite window where the analyte begins to decrease or increase? You have to check. Is there something wrong? Are we doing the right thing? So it's our job. So that's why we have to learn about this. Temperature specimen, I told you for some, the temperatures can be room, some of them in the fridge. So this is what we are talking about. Some should be in the freezer when it's a blood bank. When the plasma is collected, remove the plasma, immediately put under the temperature of cryopreservation. We call negative temperature should be maintained. Why? To maintain the specimen integrity. There is a shelf life period. Shelf life period is a period for that particular specimen to sit inside the freezer or a fridge. After that, that has to be discarded. And now my question, how do they do all these things? Who says this is the temperature, this is the negative temperature, this is the body temperature, this is where you have to keep the specimens? Who's giving, who's the authority? Who's telling them?
It's based on the standard operating procedure of the lab.
Standard operating procedures, yes, I understand. But how do they know?
CSLI.
CSLI. Amina, you are always in the procedure of inventing new things. It's CLSI.
Oh, CLSI. I'm sorry.
No problem. Who is giving? Some higher organizations or the authority, the authorized bodies who are doing the research, who are there working day and night to confirm that this should be done, this should be done. They have a team of research groups. They are involved in this to make sure this is happening. All health professionals, all the human, like the MDs, the specialists, they do this job. And they have a union and they have a unity where they send the information. And of course, we talked about the World Health Organization, the CDC, everything is involved. So it is the message that's given by the higher authorities who are in the medical field. So light exposure, UV may break down certain analytes. Example?
UV.
Bilirubin.
Bilirubin, very good. Bilirubin. Any other analyte? Carotene, lactose. So some of them are very sensitive to certain situations. That's why we have to use ice when we are collecting blood to test the lactose, ammonia, it should be on ice. Why? There is a reason. And
Yes.
light exposure or UV to certain samples, the beta carotene, if someone wants to test, or someone wants to test the, the bilirubin, they are very light sensitive, which means they can break down easily. So what's wrong with the specimen or the analyte need not be done properly. So we have to follow the procedure. Now, how will you do this? How will you avoid this?
Using the tinted tubes for collection.
Tinted tubes is a collection. Very good. The other option is aluminum foil.
Yeah, foil. Yeah.
Yes.
Aluminum foil.
Aluminum
Okay.
foil.
And the time is also sensitive for certain analytes to be tested. And we have to be careful. So we should know how to transport, when to transport. Everything is important. Why? Because the analyte in the specimen is important. Now, what do you understand by time? Amina, CLSI states the serum. Look at this, the abbreviation. It's not CSLI, it's CLSI. Okay?
Don't mind me. When I'm trying to do it fast.
Yeah,
so
that's
I
okay. You
remember
did a good
Canadian
thing.
Laboratory Standards. Yeah.
Institute. Very good. So states that serum or plasma, so look at them. Who is now this is important because who mandates that the serum or plasma should be removed from the cells as soon as possible within 2 hours? Who mandates this?
CLSI.
CLSI. This is a question that you may get. Within how many hours? 2 hours.
2 hours.
What need to be separated? The serum and the
Plasma
plasma.
and serum.
Who mandates that serum or plasma should be removed from the cells as soon as possible within 2 hours?
CLSI.
CLSI. This is an exam question. If there is a separating gel, it's not necessary to aliquot or separate the serum. This may come in true or false. True or false question. If there is a separating gel, is it necessary to aliquot or separate the serum or plasma? True or false?
True.
It's not necessary.
Not
False.
necessary.
Yeah.
False. Okay, careful, read the word, which is exception. This you should know. Read the questions. Don't get excited. As we have seen one question, yesterday they talked about the fragile skin, not the fragile vein. Clear?
Yeah.
Okay, now, best practice is to transport samples quickly and begin testing as soon as possible. Why? Why do you think you have to do this?
To ensure the most accurate possible
Accuracy.
test results.
Accuracy, very good. Accuracy. So the patient shouldn't be considered as like something positive to negative, negative to positive, and no wrong diagnosis should happen. No wrong medication. There are so many patients here. Can you believe by expert doctors have given them wrong medication? Can you believe this? Sometimes I was wondering, like, whom should we trust now at this point? Like, what we have to do? We all have to become doctors. Is it possible? Sometimes now, like to my knowledge, majority of them, they are into the internet, Google, Dr. Google. Why? To find if the doctor has given the right medication. What are the possibilities? Is there something? There's one more thing called Health or something, medhealth.org. There's a website. It gives the detailed information about, you type one thing and then about any disease, what are the conditions of the disease, how it will be, what are the do's and don'ts, what are the positive aspects, negative Pub Health Med or something. There is some website. It's amazing. It gives everything, what you have to do, what the doctor should do. If you have a blood pressure, what the doctor should prescribe, which group of medications. If someone is having diabetic and the blood pressure, what should be given? If it is an antibiotic for some infection, which will be suitable for which type of patient? Oh my God, the only thing is you don't know the name of the medication, but you know the group of medication that's prescribed. It's amazing. That is the Dr. Google. Dr. Google, many people now, they rely on Dr. Google because of the wrong prescribed medication by the doctor. And I'm not kidding. Because of the wrong medication, the kidneys are damaged, heart is damaged. In spite of all these filters, like to give the proper, to do the proper diagnosis, to do everything, only few doctors, they do their job properly because they put their soul, their mind, everything into that. And I think some people, they just learn as a namesake and they don't care. So this is a thing that we all should know. Make sure that what you're taking, what's given, find an experienced doctor, like by like the experience, like they will know instantly what's going on and everything. But you should also have an information, but don't go in advance into all the details and don't go sit in front of the doctor. You know what, doctor, I think I have this. I think you should give me this medication. No one will like that. And they will say, okay, go home. Now you are the doctor, mind your business. Don't come here. We need some person to give some medications to send us for reference. There should be a requisition. So just have an idea about like what's going on, but don't interfere with them. Okay. So temperature, some specimens need to stay at body temperature. I told you, right? To avoid precipitation or agglutination, this is the blood bank thing. Or even the blood specimen is the best example. The whole blood, the CBC is an example. Preheating the blood tubes and put into a heating block right after the collection. Some specimens has to be like warm. We keep it in the water bath. The best example you'll be doing in the next module, the hematology reticulocyte. You have to put it in the water bath to check if there are remnants of the RBCs, premature RBCs. And some specimen need to stay chilled at around 4 degrees, right? So prepare an ice slurry if it's for ammonia, okay? And once collected, transport to the lab in slurry. Use a refrigerated centrifuge to spin and test immediately if there is a condition. So now we are having one more refrigerator called the centrifuge, called the refrigerated centrifuge. It's amazing to know why, because we have to test something keeping in ice and it has to be in that particular temperature. Ammonia is the best example. And it's a stat. And most specimens are good at room temperature, but not for a long period of time. And photosensitive, we know about this one. We have seen this in the lab. You even have, I think we have collected some blood in this type of tube, the bilirubin thing. Some analytes start breaking down when exposed to UV rays. After collection, protect the sample by using an amber collection tube like this, or wrapping it in a aluminum foil. Bilirubin is the test most affected by UV. Okay. Now, what do you understand by photosensitive? Photosensitive?
Light sensitive.
Breakdown.
Light sensitive. Instead of getting the question as some analytes are light sensitive, you may get some analytes are photosensitive. So make sure you're picking the right answer. Example for temperature and time is ammonia. We just talked about it. If it's an inpatient in the University Health Network, which is concerned to the hospitals, collect in lithium heparin PST. That's a green tube. Collect and transport to lab within 1 hour. Mostly they say within 15 minutes. It's a stat. And 1 hour in ice slurry, so ice and water, like at 4 degrees. Spin in refrigerated centrifuge if available. If available, they're talking. But this is a stat. It should be done within 15 minutes. Outpatient, if it's a life labs, collect in EDTA. Now look at the difference. If you get a question, if a tube is used to collect the ammonia, EDTA can be used. This is the best example. This is a best example. If it is an inpatient, so majority of the hospitals, they use the PST green, the mint green for the stat. But if you are using the mint green, it can be done within 1 hour. So if you get a question regarding that PST tube with lithium heparin or light green, the option you have to pick is 1 hour. If the question has been asked as an EDTA tube and you're testing for ammonia, then what is the time?
15 minutes.
15 minutes. Clear? This slide is important. So Alicot plasma and freeze at minus 20 degrees and it should be frozen, ship frozen. Okay, which means it can be maintained like that. And then whenever you want to transport, so this, in case in life labs, if they want to transport it, when they collect in the collection center, if this specimen has to come to the core lab to me, it'll be on ice, like mainly as a frozen sample of plasma. Clear? And it has to be sent immediately. So the collection department has to do. So if you are working as a phlebotomy technician, if you receive it to check for the ammonia, these are the procedures you have to do. EDTA procedure. Collect it, separate it, put it in the deep freezer, and then it comes for testing. Example for temperature and time, prothrombin. This is another factor that's really, really important because many deaths have happened because of the excessive bleeding. So this is a breakthrough in the medical field where they now can save the patients based on the 13 factors that are associated with the bleeding. There are 13 factors associated. Why? If one is missing, there can be a bleeding. If one is not functioning properly, there can be a bleeding. It can be due to environment. It can be due to majority of them, they are hereditary. They're hereditary, which means the genes are associated. But our concern is, it's okay. The genes are associated. How you save a patient. And that is time sensitive also. That's time sensitive also. Okay. Now, when it comes to prothrombin time, this is for the bleeding factor. We call this the time taken for the blood to clot. That's called the prothrombin time. Now, to find that, if it's a hospital, it should be collected in the sodium citrate tube, the light blue. It doesn't matter wherever you are, in which part of the globe you are, it is only in the light blue. And here the collection is sensitive. It's always up to the mark, like 9:1 is the ratio. Why? We are going to see 13 factors associated with it. And for that, we are going to mix it properly. And the calcium has to do what? The calcium will bind with the sodium citrate to form calcium citrate. Sodium will be released, and then the procedure will be done in a safe way. We can't use the thrombin tube for this because it will interfere with these results. You should know this. Definitely, wherever you go and do the ML Power exam, one question will be from the light blue tube. 9:1 ratio will be there. Keep this and record this in your mind. So double centrifuge for platelet poor plasma. This is one thing that we are learning as a new thing. What do you mean with double centrifuge? One time you centrifuge, again you centrifuge. Why? You want to make sure the platelets, if they are poor in the plasma, then only it won't clot. That's the reason we want to make sure. Aliquot 1 to 2 ml to clean plastic tube, freeze immediately and ship frozen. Which means you freeze the sample and then send it for further testing in the analyzer. We don't wait for all these tests. Outpatient, if it is a life lab, if it is an outpatient lab like the life labs, collect in sodium citrate tube, which is a light blue, send entire tube, okay, by keeping it at room temperature. If testing is delayed more than 24 hours, then freeze PPP, Aliquot, and ship frozen. This is another thing. So these things you have to have an idea. I'm not telling this as from the exam point of view. They don't confuse you with this inpatient or outpatient, but sometimes they may ask. If you're in the hospital, what you have to do? If you're working in the life lab, what you have to do? Life lab in the collection center, what you have to do? Clear? You want me to repeat this?
I'm good.
Because this INR procedure is important. Wherever you go, INR, blue tube, prothrombin is there. You will get a question. And sometimes they will ask in the light blue tube, what is really happening with the calcium? It's chelated or it's diluted, it is precipitated. So many things. What do you have to pick? Chelation. Chelated. I explained it to you in detail what is happening to the chemicals that are there in the tube, in which form they have been introduced for as an anticoagulant. I talked about it in detail. Now you should be having a clear idea about what's happening to the tubes with the specimen, right? Yes or no?
Yes.
Yes.
How many of you yes? How many of you know? Asinat, yes or no?
Yes, miss,
Asinat,
I'm good.
Alexia, because that's the main thing. Alexia, you know about what's happening in the tube?
Yes.
Okay, Amina,
Yes, ma'am.
Asinat, Christiana,
I answered already, miss. I said yes.
okay, Chris, Sarina,
Yes,
mine.
yes,
If
I'm
you
here.
want me to explain again, I can explain again tomorrow, but you should know about the anticoagulants, its ratio of collection, what is happening, because you will get questions based on that. Okay, let us proceed further. So if it is in the life, okay, if it is in a hospital, collect it in the light blue tube, double centrifuge, and Aliquot 1 to 2 ml to clean plastic tube, freeze immediately, and then you send it for testing. And if it is in the life labs, what do you have to do? Same collection. What is the ratio for this tube?
9 to 1.
9 to 1. 9
Yes,
to
to
1.
one.
Even in the
9:1.
sleep, you get up, someone asks you 9 to 1. If you're in the class, 9 to 1. If you're writing the test, 9 to 1, 9 to 1, 9 to 1. Very important. So collect in sodium citrate tube, send the entire tube. This is the difference. Here they're sending the entire tube and it should be at room temperature. But in the hospital, what they're doing, they're taking it, aliquoting it. So here comes the aliquoting thing. This is your job. And if testing delayed more than 24 hours, if it's a life lab specimen, then what you have to do? You have to do PPP and freeze. Okay, transport. Is it clear up to that slide?
I have a question.
Yes, who's that? Go ahead. Mhm. Yinghua?
For last,
Mm.
could you please last page? It's for light blue, the inpatient in life lab. Yeah.
Mm. Outpatient,
Is the testing delayed more than 20 hours?
24 hours, yes.
Which must be separated within 2 hours. So if testing delayed more than
Now for
20
this tube,
hours, here
this
is what
tube.
is the testing? Yeah, for
Yeah.
light blue.
The light blue, actually they have to do it within 2 hours. In case, if there is a situation where some people they forgot maybe, or due to some reasons they never send it, it has been there, then this is the procedure you have to do. That's what it means. They will do the necessary steps immediately. Majority of the labs, they follow the same. In case, due to some situation, the courier has not been sent, this we call the courier service. Okay, if it's not done properly, this is the procedure that you have to do. But usually, this is an exception case. What they do, they discard it. They will tell the patient to come again to collect. They don't want to take chances when it comes to the clotting factors. Why? The patient may die. It's a sensitive test. They make sure everything is good. If there is even little flaw or fault in this test, they discard it, they call the patient to collect. That's the procedure. Clear?
Okay, thank you.
You're most welcome. The next one. Okay. Transport, 3 main areas of transporting lab samples. This is something very interesting, but it's you have to know this. If it's in the hospital, clinic to the lab, this is the mode of, this is a method of transporting to test blood samples collected in the clinic, and then it'll go to the lab directly inside. As I worked there, like in the MCI clinic, there will be the doctors, and then they will send with the requisition to the lab there. And then we pack it immediately based on the protocols. If something is coming for the parathyroid, I have to centrifuge the EDTA tube. This is the protocol that's followed by the Dynacare. So they work under the umbrella of the Dynacare. So I have to follow that standard. Where we get the information, there is a chart. I have to double check, and then I have to make sure. So this you will get by experience. After taking the plasma, I put it inside the fridge. Why? They will come and take it to the lab, because there is a shift. There is a 11 o'clock shift, 3 o'clock shift, and 9 o'clock shift. The people will come and they will take it. Intra-lab. Intra-lab means within the lab, one department to other department, it'll be, we all know intra means within. For example, now I'm working in the life labs in the core testing area in hematology. But when specimens come to hematology, if it's a light blue tube, there is a sub-department called the coagulation department. It'll go there for testing. So it's an intra-lab. Within the lab, we have that facilities to, if the collection site is associated with the lab like this, so that will go to the hematology, from hematology to the coagulation. So this is the intra-lab. Within the lab, they function. Intra-lab. Intra-lab is something that we send it to the reference lab, as we talked about. Intra-lab means the specimen that's been collected is coming to one lab, and it is sending to another lab to confirm the testing. It means test between 2 labs. Inter, 2 labs. Intra means within. Okay, and on-site means in the same area, collecting, testing, collecting, separating, everything is done. So these are the 3 examples of the functioning of labs. Clear? Any questions? And what is called the satellite lab? Satellite lab is the another reference lab which belongs to the, for example, if there are so many collection centers for Dynacare, they are the satellite labs for the main Dynacare head office core lab. We call this satellite labs. If there is one core life labs, all these small life labs, collection centers, or these satellite labs, they function together. But the samples will be transported from that lab to the testing lab. So there are 2 labs, and now they're functioning to get the result. Clear?
Yes.
What is a reference lab then? What is a reference lab? We talked about the satellite lab. What is a
Where-
reference lab?
It's where
Go ahead.
we send the samples to test the quality control of the
Quality
instruments, like the
assurance.
analyzers.
Yes,
Okay.
very good. Quality assurance. Very good. Good job. So on the on-site transport, now this is a bit detailed. So let's say you're drawing blood on a ward and you need to get the samples to the lab for the testing. This is the on-site. This happens in the hospitals or clinics, in some clinics. Best way to transfer blood tubes is upright in a rack. Why in a rack? Because no courier service is there. There'll be a cow caught on wheel. So that will be transported by a person. In some countries, they have this, I like this system. In some countries, they have a conveyor belt. Everything is like secured, like a tunnel. They will label and then put the requisition along with the rack, and then that will be passed on to the conveyor belt, and people who are there in the lab, they will take it, and then this is really beautiful. They don't want any human service at all, done by a conveyor belt. I like that. And it's upright in a rack to avoid agitation and ultimately hemolysis. If collecting on site, can walk the specimen down this way. So this is very easy job. Also draws blood away from lid, which reduces aerosols when opening. So this is also one thing. You're collecting and sending it within the same area. When this is done, this is called the on-site transport. What are the advantages? No hemolysis, no aerosols, and no agitation. 3 points. What is the advantage of doing like this? No agitation, no hemolysis, and no aerosol. Clear? And what is in this on-site transport, if coming via a pneumatic tube? Now we are going to get a question regarding the pneumatic tube. Yes, Azinet?
Yes, for the transport of the specimen, like say for instance in an hospital situation, can you do like a tube? You know, they have that vacuum tube. You just insert it into, and then it goes to the lab. Is that possible? I know we do that, like.
We have the ETS, right? If you're
That's
collecting a sample in an SST, mainly let us talk about the light green, because majority of the hospitals, they want the light green because easy for them. They have very good analyzers to do to give the results instantly, a quick process. They will collect the tubes and they will put it in a rack, in a cart, and then it will be sent to the lab, testing lab, where the analyzers are there. Is that what you want to know? They don't want to transfer anything.
Asking
She's
about
asking
the
the pneumatic tube.
system.
Oh, pneumatic tube is what we're going to talk now. Yeah. So
Yeah,
if
that's what I
coming
was.
via
That's what I was
yes,
asking about.
yes. If coming via a pneumatic tube, ensure tubes are in biohazard bag with any paperwork in outside pocket. So I think you're talking about this. Yes, we have the pneumatic tube system. This is what like we usually experience in big hospitals. What is it? It's a network of long tubes that connect various parts of the hospitals together. Emergency wards, lab, pharmacy, everything is connected. An easy and quick form of transport using compressed air or partial vacuum. Carriers must have foam padding. Why? For the safety. So it shouldn't be crushed, it shouldn't be damaged. And all only good for transporting approved items. Only if the items are approved, then we use this system. The turns and speed of the system can lead to hemolysis of specimens. But here, look at the disadvantages. In the previous one, we talked about 3 things that doesn't happen to the specimen. What is that? No agitation, no hemolysis, and no aerosol. But here there is a disadvantage. Of course, the specimen is protected. it will be connected to different parts of the hospital. But here there are chances because the turns and speed of the system, it's very clear. So based on this, you will get a question. The turns and speed of the system can lead to hemolysis of the specimen. So here there is something which is not really, really appreciable. So if something is like this, question. Clear, Asinet?
There, Miss. Thank you.
Yeah, this is what they are showing it as an example, the pneumatic tubes.
Yeah, that's it.
Yeah.
That's what I was referring to.
Yeah. So intra-lab transport, this is easy. This is what I'm dealing with. This means blood is being moved around within the lab. Example, accessioning department to analyzer to storage. I'm in this. Now I'm in this setup. Clear? Best to always carry sample upright in the rack. So I don't have to carry that. It comes to me in a cart. Someone brings it gently, moving gently. Do not put the sample in your lab coat pocket. I don't do that. Many have been forgotten there and left overnight. So this is where the light blue tube issue also has come into effect. If I'm working in the, for example, I don't do this for example. If I'm working in the coagulation area and accidentally I was busy doing something, there was a tube there, I took it, I want to note it down and do something and to put it in the analyzer. I forgot, now I feel like drinking water or going to washroom. I gently put it in my lab coat and then I'll go hang the lab coat there. And then I go to washroom after half an hour, I'm coming. And then I'm wearing the lab coat still, I'm forgetting. The next day in the morning when I come to the shift, oh my God, this is here, what I should do. That's where the 24-hour, the blue tube situation may happen. Clear? Do you think we have to do all these things? We are humans. Human error is possible. We have to avoid. But it happens. No. Forget about I'm putting in the pocket and the separating, aliquoting. You know, the people go crazy if one sample is missing in their 8-hour shift. The next shift comes, they go crazy because they have to make sure that the previous whoever has worked there as a technician has documented that there's no pending sample. If it says, it will completely show, if you print out the samples of 10,000 that's been run in an analyzer, at the end of the shift, you have to sign, make sure everything is perfect. Even if one sample is pending, you have to make sure as a technician, where did that sample go? Why? This will be in the system. And everyone knows that this is here. But where? In someone's lab coat? They don't know about that. And the next technician who is following the job will go crazy looking for because I will make a note. One sample is pending. Look it in the fridge. Which fridge? There are 4 or 5 departments. I told you once 2 samples went to some other fridge in the micro department. It should be in the hematology. We were going crazy for 2.5 hours. I was just roaming in the lab looking for department after department. The time, you know, the frustration. I have to go home. Already my shift ends at 12 in the night. I'm there till 2:30 looking for the sample because someone made the mistake. People will go crazy. So we should avoid these mistakes. These are the mistakes to be avoided when you're working as a technician. Then I have to, at the end, go to the micro lab, and I took the help of the 2 other technicians, and they said, oh, it's sitting here. Why it went there? Because of the lack of focus or carelessness. It went there. Why? The label that is telling that particular code has not been identified properly by the technician who was doing the job before. And they say when the next person comes for the shift, they have to make sure that is released. The pending sample is released. And after my specimens, now I'm looking for that specimen going crazy and pulling the specimen, bringing it, I'm going home at 2:30. Avoid, if you are a technician in that position, try to avoid all those things. People will go crazy. Do not put the sample in your lab coat pocket. The best example, Take a look when you get into your own lab and see how specimens are moved around. Are they following best practices? Is there anything missing? And the first thing you do the checklist. What I do, I go wash hands, PPE, I enter, punch, because I have to get the money, right? I'm working, punch. Then I come, put the analyzers into functioning, and then I check the quality control of the analyzers. I have to run the QC. Meanwhile, I have to check in the computers anything pending from the previous shift. Usually it should show 0. If there's 1 or 2, I have a problem. Why? At the end of the shift, I have to make sure where it went. I have to record it and then do. It means I have to follow the best practices. It's my job. Where the specimens went, how they moved, is there something missing? Is something pending? That's what they're talking about within the same lab. Why I'm explaining? Because when you may be hired in those type of labs, so make sure you do everything perfectly. Okay, next one is the interlab. Interlab is the one, you'll have the vehicles, Dynacare. You have seen this in the road, so many Life Lab vehicles, Dynacare vehicles, because these are the competitive companies now in Ontario. Okay. Transport of specimen outside of the primary testing location via couriers. We call this couriers. You will get one question. What is the name of the transportation of specimens outside of the primary testing location called? A, courier, B, transportation, C, some other thing, D, some other option, pick the courier. Example, sending samples from the collection site to the lab for testing. This one example again and again I'm repeating. Sending out referred sample for testing to another. This is called, what type of lab is that?
Satellite labs.
Sending out referred sample.
Reference lab.
Reference.
Reference lab. The first one is the satellite lab. That's the satellite lab. That is the same Life Lab, collecting centers there. They collect the specimen coming for testing in the lab, satellite lab. If it is a referred sample and it's going to for the reference for quality assurance to another lab, that is called the reference lab. Do you think they have to do this? Do you think they have to do this, the reference thing?
Yes.
Yes, yes.
Why? Why?
To make sure of the quality of
To ensure the
analysis.
quality of the specimen, yes.
Yes.
Because they have to deliver the quality results.
Yeah.
Okay, good job. So sending containers, the specimens labeled properly. We talked about this in the beginning. I showed you the cardboard box inside. How many layers should be there for packaging or packing?
3.
3, very good. Packaging must withstand adverse conditions, of course. That's why we have the cardboard. Inside there is a bubble wrap, and inside there is a container. Within the container, something is sitting. So all forms must accompany specimen. Dry ice must be labeled. Why there's been like transport on the dry ice? To maintain the sample integrity. TDG rules should be followed. Where to look for the TDG rules? Who told them this is how you have to transport? This is the number that should be given. This is how you have to sign the form. This is
The United Nations.
The United Nations, and mainly they tell the transportation of dangerous goods.
And it's also in the website for Canada.
Yeah.
Government.
It's
Canada.
for all. Wherever, in which country they're transporting the same chemical, the UN number should be there. The procedure has to be, it's a protocol, universal protocol. You can't say, I'm not going to do. No country says, okay, you make the rule, I'm not going to do that. No country can say that because it's common. Why? It's for the benefit of the humankind. It's for us, for our safety. Any questions? No questions. Can we
No,
move
ma'am.
forward?
Thank you.
Okay,
Yes.
you're most welcome. Is it Eveline is the representative of the whole class? Can I take that into account? All of you. Sineda, Yusra, Yinghong, Verna, Shabana,
it is.
Santiago, Rigato, Maris, Luis, Cara, Joanna,
Good.
Huda,
Yeah, we
Eveline, Zarina Mine, Chris. Okay, good. Zarina Mine, Chris, Christiana, Azinet, Amina, Alexia. Are you okay? Everyone is okay?
Yes, okay.
So now
Yes,
moving
ma'am.
forward, like
We're
refrigeration.
good. We're good.
Good, very good. Thank you so much. Specimen storage. Why we have to store? Yes, come on, go ahead. Not this Friday, we don't have a test. It will be part of the test. Few questions, yes, you will get it. But it's interesting. Is Munmun is coming from Monday. Next week will be a lab week for you. So focus on the venipuncture stuff, everything. Fill the books, get it signed. And maybe she can start with the hematology practicum also. So you know what to do, the ESR and all those stuff. But the following week, you may be having a test on Friday because she has to decide. But you have enough time to practice. That's what I mean.
Also,
Next week,
so the
next
final is
week-
not in this coming Friday?
not this coming Friday.
No,
Okay.
no.
Oh,
We don't have no
Okay.
test this Friday.
okay, okay.
No exam. Well, you want to write it on Friday? I can just set up for you if
No.
you want.
No.
But there is a schedule. We have. Yeah, no, that's
Okay.
not the case because test is
Okay.
different, exam is different. Test is something that we are testing for a particular unit. That will be easy for you. When it comes to the exam, it's like a cumulative process. All the units of this lab safety put under one roof. That's it, one thing. That's the final
Miss,
exam.
so
That test will be in school, right?
Yes, usually they have this final exam in the campus. Okay, or on the campus. Yes, go ahead, Santiago.
no, never mind.
Never mind, you wanted to ask something.
No, my question was answered already.
Already answered, very good. So just relax. This is something you are learning still. Tomorrow we have the whole 4 hours for just to revise, to bombard with question answers. That is sufficient for you to do the exam. But still you have one whole week. As a practical, you do the practicum, you go home, practice. Go home, practice.
Wait, Miss.
Yes.
Oh, so our test will be not this Friday, but the next Friday?
Maybe, but it's up to you. The Munmun comes, she will just do that.
Oh, it
because,
comes down to whatever she wants, right? Okay.
yes,
All
yeah,
right.
she has to. If you're ready, I would say go do it early as possible because the information is there. Complete it. And we'll be doing enough revision till Friday. And Friday will be an early release day because you have to complete all the pages that I have given it to you. Which means you have to go through that again and again. We have such a big bunch. So next week, you have enough time to practice though. Even if you practice from those things is enough. Even if you just focus on the questions that we have already done, that is also enough. Some questions, usually they collected from the previous tests, they put it for the final exam. I'm pretty sure about it. They do that. So focus on those and you will be good enough. Just for passing, now you're all good. But for me, my goal is to lift your spirit when it comes to the course. When you see good grades, it means you feel like motivated. You feel like, oh, we are great, so we can do. So this is the feeling you will get. And this is something which is required for this course. Yes, Azinat, go ahead.
How many questions are on the exams?
It's, I think, 100 questions, but the time
Okay.
is 110 minutes. 110 minutes is 60 plus 40. Yeah. She will tell you.
All
She
right,
will tell
thanks.
you, yeah, she will tell you, and then you have, but my goal is I have to make sure that I don't have to do this, but I'm doing this to my students because to just motivate them to get good grades. Because what I have told you, I have dealt with so many batches, but they struggle in spite of the knowledge they have because they don't know how to select the answers. So that's one of the reasons. Okay, based on my experience, I'm doing this. Okay, specimen storage is refrigeration. So we are all good, right? So refrigeration means it's a standard procedure just to maintain the specimen integrity. Why? Because whatever is there, it will be maintained as it is if it's a fridge. But make sure the fridge has the temperature range. What is the range?
2 to 8
2 to
degrees.
8.
2 to 8 degrees. What
to 8
happens? That's why we always make sure daily when our shift starts, it's important to check the humidity of the room, temperature of the room, temperature of the fridge. That has to be recorded as a checklist. The reason is because of this, we are using the specimens, we are using the reagents that will all undergo some kind of changes, like if it's not maintained properly. So based on the protocol, we have to do. So stored in an upright position, of course, we're not going to keep it inverted, and either numerically or by date of testing. Okay, date of testing is the best way. So this date, this batch, we call that batch. Batch means, for example, there is a morning shift, there is a batch, morning batch, evening batch, night batch, night shift, evening shift, morning shift. This is how we operate. Each lab will determine its own specimen stability, stability criteria, which means a time limit for testing. After 24 hours, everything will be discarded. Where in a Stericycle big bin, and then they will come and take it and they will burn it in like the temperature is really high when they burn. Example, most chemistry tests can be performed on separate serum or plasma for up to 7 days. So now, some of the analytes can be kept for 1 week. The best example, serum plasma, they can be kept for 7 days. But how will you do this? We have learned before, serum and plasma has to be separated within 2 hours. Who says that?
PLSI.
TLSI, very good. Now,
PLSI.
when it comes to storage, they're telling, wait, chemistry tests can be performed in separated serum or plasma for up to 7 days. What will happen if it is with the blood? Some other chemical reaction might have happened, so the results won't be accurate. That's why we wanted to separate the serum and plasma from the blood. Keep it separately in the fridge, not a problem. This is where the requisition by the doctor for add-on can take place. Mainly when it comes to chemistry, they want to add on an electrolyte testing. They want to see something from the patient that they missed. Now they want to know something. What's wrong with the patient? Maybe I had to give for this testing, give this to prescribe this drug. When something comes like this in the mind of a doctor, they will call immediately to the lab. Okay, for this patient, he came. You might have received this specimen. Yes. Can you do this test and send it? Yes. You have to pull the serum plasma and do it. So in chemistry, this is possible. Clear? Okay.
Yes,
And we
please.
call that add-on. We call that add-on. Cancel, we all know cancel because we have heard about the cancellation so many times. So it's not a problem. But this is the first time we are hearing about add-on. ADDON. Add-on means a test should be added. Do you think you have to document it?
Yes, miss.
Yes.
It's immediately documented in the website. That's the lab information system. You go click the page. There's an option called add-on, click it. And then for the name of the patient will be there. Click in that particular area and then you proceed, you document and it will be under your name. So it means you did the job. So now, specimen storage in a large lab. This is how we store. Huge, huge. Okay. How long can tubes stay at room temperature? This is another one. CLSI. So not me, not the college, not the labs, the Life Lab, Dynacor, they say this. CLSI says serum and plasma that is separated from the cells can stay out at room temperature for a maximum of 8 hours. Exam question. We have 3 exam questions only based on serum and plasma. What is that? What is that? Serum and plasma should be separated within 2 hours of collection of the blood. Question number 1. Question number 2. These can be kept or stored in the fridge for how many days?
7 days.
7 days.
7 days.
Third option of question is they can stay outside in the room temperature, but for how many hours?
8 hours.
8 hours.
8 hours. After that, what you have to do, you can put it in the fridge. So you may get question only on the serum and plasma like this. Okay. After the time they can go, after 8 hours, they can be in the fridge. Now, this is why we are recording the humidity and temperature of a room. Why? Do you remember we documented the humidity and the temperature? We are not testing anything from the real patient. That's why we record whatever we are seeing on the clock. But in the usual procedure, it's very sensitive. When I go there, I record the humidity and temperature, fridge temperature, humidity, then the room temperature. Disinfection log is another thing, is priority that I do because I first enter, I disinfect everything, initiate, I did this job. The same way when the person is going to start the next shift, they have to do that. And remember, cleaning or disinfecting is part of our job, is attached to us. We enter, we clean, we leave, we clean. But we document the first one. Clear? Okay, some automated systems move specimens directly from the analyzer into the storage. So there is a facility for some. Directly, it will be there going to the storage in the fridge, and after the analyzer is run on the analyzer. So this is one thing. Any questions?
9 months.
After this, you're good?
No, ma'am, we're good. Yep.
Okay. Let's move on to the non-blood specimens. Now, what do you understand by non-blood specimens? What are they?
Like urine.
Urine,
other
body,
fluids.
any other
Other
body
fluids.
fluid, joint fluid, semen. Yes.
Swabs.
Oh, okay. Good. We know the difference between the blood
Skin
and the
scrape.
body fluid, right? Yes. Oh, someone is. Shabana, I think, yeah, you have to move. Okay, the non-blood collections will go into more detail of these type of, and you will definitely get questions when it comes to urine samples. For some reason, urine samples have always been considered important, even from the previous years. When someone is having jaundice, urine. When someone is pregnant, urine. In those days, physicians, I can recall those days because I'm in close contact with those situations. Just they take the urine, and then my grandfather used to take the urine, and then they'll say, okay, this is a condition. I used to ask how they do this. They say, okay, we experience this and we know based on the color, based on the texture of the components inside, based on, I would say, precipitation. Yes, Kara?
They also used to taste it.
In those days, yes, they did that. Yes, yes, it is true. So urine has been an important analyte, even from the previous eras. So it is important. When the medical the history started, so they started with the urine. Then came the blood, and then now there are wonders in the medical field. So we will go into more detail. When it comes to urine samples are always important. Focus on those questions. Okay, urine and micro. Micro also, what they are telling us, we have a separate module as urinalysis and microbiology. So you'll be learning it in more detail after the midterm. This is just a brief introduction. So they say it's an introduction, but you should know I'm not going to go in detail, except I'll give the importance of those specimens. We have to just brush up with our knowledge. I'll tell you what are the important questions from the exam point of view based on the lab, what do you call safety fundamentals. But remember one thing, as they mentioned, there is a module called urinalysis and microbiology. In urinalysis, you may get few questions, but micro has more questions. Both are interesting modules. This is just a brief introduction to different samples. As we all know, you should know how to handle them, how to give instruction to the patient when it comes to collection of urine. Most of these collections are patient collected. We are not going inside the washroom to tell them to collect. It's really ridiculous. So we will give, this is what, as a technician, we should know how to provide the instructions to them. What will you do? See the requisition. There'll be a check mark for the urine content. So take that paper, give them the sterile container, give them the instructions. Of course, you have to put a label and then give them. And then tell them the procedure, how to collect based on the requisition, what the doctor wants to see. It's up to the MLAT to give clear and easy to follow verbal. So here comes your role. This is an important role. As I told you, you will be doing the point of care testing as a technician. Your another important role is how to provide the instructions for a patient when it comes to fecal or urine collection. It's very critical because if they mess up with that, the results won't be showing the accurate ones. What the doctor wants to see in the urine will not be like there. So they have to repeat it again. Why? Because the microorganisms are more associated with the urine component when it comes to infections. They want to see that. So as a technician, you have to give a written paper also. Sometimes not verbal instructions are okay. Some people, they have to read. They will read it and then they will collect the urine. Now, why we have to do that? Because we have different types of timings for collecting the urine. Based on that, we are seeing now, one is the clean catch. What do you understand by the clean catch or midstream urine? Midstream urine. You discard the first part, yes, and collect the middle part of the urine. That's called the midstream urine.
Yes.
And this is also called clean catch because this is a catch where the body components will be get rid of the enzymes and the hormones, whatever is there will be taken out. And if they want to see something, the microorganisms or something very clearly, this is good. So there is a reason behind that. We will see. Collected in sterile containers only for culture and sensitivity to see which microorganism is sitting there in your bladder, causing the urinary infection. And this is very common nowadays, urinary infection. Patients suffer, right? And it can damage the kidneys if not identified properly. So it's something really critical. So you have to give them clear instructions. If they bring the normal urine, they may not see the microorganism sitting there when it is when you're going to, again, you have to set up for the culture for this. So this is the reason it's very, very important. Cleaning process to avoid skin flora. What is flora contamination? Any other bacteria sitting outside the area shouldn't be entering inside. Not shared with other urine tests. Leaking CNS urine is compromised. So which means we have to take care of this particular midstream urine or midstream clean catch is the term that we use. Very, very sensitive, very, very important. MLPAO question, final exam question, term question, everything is there in this MSU. And when you talk about the MSU, definitely there is a word called CNS is involved because we are seeing the culture and sensitivity, which means which bacteria is sitting there to cause the infection, which antibiotic should be given is confirmed based on this catch. So this is something very sensitive. You can see under the microbiology urine section. That's for the MSU. If it is on the normal urine, that should be random or first morning. If it is this MSU in the requisition, Munmun will teach you further. So, or when I'm there for the urinalysis, like with you, like you will be knowing, because I'm a lab person. I'll be in the lab with you. I believe so. If there is a sim lab coming for the previous batches, when they complete, they come to me for sim. If I'm there with the sim, if you have any question, doesn't matter, during the break time, you can come to me, I can help you. If I'm there in the lab with you, I can help you. So anyways, if I'm there in the campus, I can help you. And first morning, why we call the first morning? It's good for testing analytes of interest. What do you mean by analytes of interest?
Those are the specific gravity, the turbidity, the glucose, protein, and for microscopic, ma'am, examination.
Okay. Is anything coming to your mind? No? Like the enzymes, the hormones, the drugs that you're taking, if it's
Yes.
influencing in your body, they want to test it. You know,
Right.
the first morning is the best, because the first morning is a collection of the overnight, whatever is accumulating in the metabolic process, it will be ready. So that you can see. That is the analyte that they are talking about. We call that analytes of interest because the doctor wants to see if that enzyme is more in the body. Based on that, they will figure out what's the problem with that person in the metabolism. But when you use the same urine to test for the bacteria, you will see nothing. That's why that has to be eliminated. Only the culture and sensitive, the microorganism part we have to collect. This is very important. Once again, I'm repeating, when it comes to urine, MSU, first morning, and random is also important. Why we do the random stuff? Any idea? Okay, one is to first morning to check the enzymes or hormones. One is to check the bacteria. Why the random?
Well, I would say maybe for routine testing, just like random.
Routine testing, that's what Eveline
Yeah.
mentioned, the pH and all those things, what you mentioned, Eveline comes under the random.
Okay, ma'am. Yeah.
When your body, you're in a normal condition or some condition, the head is heavy, the body is paining, ankles are aching, and this is happening, that is happening. Is the glucose okay? Is the ketone metabolism okay? Is the pH okay? Is the specific gravity okay of the urine for you? All these random. Yes, Azinat.
A question is, so would you say that the first morning is
It's
like
enzymes.
fasting after fasting?
It can be after fasting or before fasting, doesn't matter. Whatever has been collected in the, because this is you, the instructions given to you in the requisition based on what the doctor wants to know the result. If it is for particular enzyme, it will be accumulated in the early morning. The first morning, it will be concentrated. They want to identify that. Whatever the protein metabolism, whatever metabolism is there in your body, the whole night it will be functioning, and in the morning it will be ready. That they want to see. It can be a
Okay, thank you.
byproduct of protein. It can be a byproduct of a glucose. It can be a byproduct of a ketone metabolism. Whatever is there, if something is not right, if they suspect something, they want to know some hormone, if they want to know some enzyme, if you are in high stress levels, the cortisol hormone will be there. Their byproduct will be there. So if the body is going up and down, it could be due to stress. How will they know? Based on the urine that they're collecting, there'll be an enzyme. So the next day, doctor, come to the office. Yes. Are you undergoing some sort of stress, ma'am? You'll say yes. Based on
Got
what?
it.
Based on the accumulation of the chemical compounds that is released as a byproduct. So that is for first morning. Random
you.
is generally they want to know, is your body okay? Or is this something beginning is going to happen? Are you, that not you? I mean, some patient is going to have a diabetic. Is he a pre-diabetic? all those situations in random. So when you take the, Moon will explain it to you. When you take this random means quickly, generally, they want to know. It's a non-specific, I would say non-specific. It's a beautiful term. Can be collected at any time of the day, refers to timing, not method of collection. It's for the timing. For routine urinalysis testing, that's it. Just routine testing. Is everything okay? That's the one. Clear? And
Yes, clear.
Types of
Yes,
urine
ma'am.
samples and tests. Types of urine samples and tests. There's a 24-hour, there's a catheter, suprapubic. And this is again the whole urinalysis, because this is happening in a daily basis. As a technician, if you're working in the clinic or in a hospital, if you are put in the urinalysis department, so you have to give instructions to the patients based on the requisition, what they are looking for, and it's an ongoing process. Because I told you from the onset of the medical field, like from the beginning in the medical history, this has been an important constituent for testing for various diseases, metabolic disorders, in everything. So urine is important. You will definitely get questions. What a 24-hour urine means? If someone is taking a drug, it could be some drug to check their hormonal balance, or for example, the old people, ladies after 50, they have the estrogen level going down. So the doctor wants to give them a medication and they had been taking for 5 years now. Something is wrong with their system because of overdose of medication or whatever, like they're consuming. Or if an athlete is going to play and he's taking something like to energize themselves, and the doctor wants to test. This is where the 24-hour urine comes into effect. What is actually happening in the system? What is separated in the urine? Is the protein metabolism something is like working good? Or is there kidney damage is there? Is something is released in the urine? Of course, blood tests will be done later, but this is, I told you, urine has been an important constituent of testing.
Yes, ma'am.
Why? Based
It's
on this,
also, yeah,
yeah.
the
Go ahead.
test, ma'am, for the glomerular filtration rate of the kidneys.
Kidney diseases, mainly
That's
kidney
right.
diseases. So what they do, if they collect urine for just one time, it's not enough. They want to monitor from the 24-hour urine. And there is, I have shown this, I think, there is the orange color, like a container, and there is a gradation, 1000 ml, 500, liters, actually, 500 ml, 100 ml, 200 ml. So there is a gradation, and then they have to collect in this. Where will you keep? In a fridge. Don't ask me, how can I store this in the, yes, go ahead.
In a fridge or a bucket with lots of ice?
Yeah. Some people say they keep a bucket with ice, and then in the basement, they keep the container. That's a good idea. But we don't use generally the fridge that at home, no. So pooled urine collection over a 24-hour period is the correct definition. You should know about it. May have a preservative. So there's a preservative inside. They will give a paper, what is inside, what you have to do, how you have to do. But you also should be able to give the instruction to the patients. Keep in fridge and protect from light. That's it. And what is a catheter? Catheter, we talked about it yesterday, about the bladder catheter. That's for the urine. If someone is not passing the urine, right? And we call that urinary stricture, which means completely the urine is stopped, but the bladder is filled. There are chances of infection. Urine has to be removed. They will put a catheter inside the bladder. It's called the urinary catheter. And then they will monitor the flow of urine and collect it from a sterile catheter, insert it into the bladder. This is what they collect, and they send it for testing. This is another method. And suprapubic method. What does this mean? We have collected in a container. We are collecting from a catheter. Supra means what? Extra special, ultra. It's not super, it's supra. Super means is something special. Supra means more special in collecting the urine. What is so special about it? Sterility. Here, the speciality is related to the sterility of the urine. We want the urine just fresh from inside. We don't want something to be collected. We don't want something to come out through a tube. Maybe it may be contaminated or something is not right. What will you do? A needle is inserted into the bladder. This is considered the most sterile method to see the urinary infections or some other processes. What is soup?
Shouldn't it be
This is-
called supracentesis then?
Supracentesis can be used, but they have a reason for using in this term.
Oh.
Okay, so a needles, because the needle is inserted, you end up in adding the term centesis. Who is this?
Kara.
Kara, yeah. That will be an apt wording for that when it comes to medical, but some people they use, before that I think they used it, now they use the suprapubic. Okay. And then transfer to sterile container. After that, they want to know exactly, this is a quick process that is done quickly to see exactly the nature of the sterile urine, what's happening, who's there. If it's an infectious condition, okay, then who's the organism in the sterile environment. When it has to do something with the enzyme related thing, the fresh enzyme, the fresh thing that's there has to be seen. So it's a more invasive collection. There'll be like a pain when they insert, and that's the thing that they have to look for. And handling for urine specimen, how they handle? Is it clear up to this point? This you have to do repeated reading. That's it. Handling for urine specimen, how you handle urine specimen, they have to be transported to the lab in a timely manner. It's a time sensitive. Why? I will tell you. And they can sit at room temperature for a maximum of 2 hours. And if there is no preservative, the max is 2 hours. If it's going to sit for more than 2 hours, put it in the fridge or add a preservative. Once what happened? What if the fridge is not working properly? Add a preservative. The best preservative to maintain the integrity of urine is boric acid. Boric acid. If delay in transport or testing, place it in the refrigerator until time to test, if you have a fridge. If something is going wrong and then the specimens are piling up, the fridge has no space, boric acid. Extended amounts of time at room temperature can affect the bacterial levels, analyte levels, cellular morphology, shape, integrity. I'll tell this why. Always allowed to come back to room temperature before testing. So this is something which is important. When we are going to, okay, if I'm going for a shift, I'm seeing the piled up urine batches inside the fridge. Now, first thing what I do, I clean, disinfect everything. First thing, I pull the urine samples out of the fridge, put it on the table, at least for 1 hour. Why? It has to be in the room temperature. Why, miss? What happens? The test results will go up and down in case of urine. Clear? If there is an infection, and if you have the urine sample, the bacteria will become inactive sitting inside the fridge. If you run that sample in the analyzer won't read anything properly. So the results will be different. Put it at room temperature and see if they will be naturally in an active stage. If you run that sample in the analyzer, you can see that, okay, this is the infectious condition, this is what it is. Okay, now, when the results are released, the exact organism will be like clearly visible, and then they will send it for the blood culture bottle test to see what is happening, and then they will confirm. That's the reason. Not only that, there are certain, in the analyzers, there are certain sensors to know the cells, some cells, if they are released in the urine, mainly if it's a cancer. If it is in the fridge, the shape may be altered because of the chillness, because of the temperature variation. And that when you run in the analyzer, the cells will show a different shape, and then we don't know what is happening. So because this is something that's very important, because this is the beginning step in identifying the nature of the disease or the alteration of any metabolic component in our body. This is a non-specific, I would say. Based on this, they will follow different, even for pregnancy, the hormones will be altered. So they have to sit in the room temperature to check if the BCG hormone is elevated a little bit to confirm it's a pregnancy. Because if you take it from the fridge, if you test it, it may show negative. That's okay, but we want to know. We are not concerned about the negativity or positivity of pregnancy, but if the patient is pregnant, if we declare and release this as a non-pregnancy, it means the patient will think, okay, they are fine, and then they will perform different activities. They are not supposed to go for a skiing or skating or whatever, like maybe it's a sensitive thing for the patient. Now, what will happen? It's not a good thing. So these are all based on the patient's condition. These are all urine is very sensitive topic. You have to be very careful. Now, comes to the stool samples. I'm trying to finish this with, no, I can't. After the break, I have to start with the stool because you'll be confused. Is it everything clear, good enough? Keep in mind, this part is important. Urinary sample, urine, the nature of collecting, the type of, I'm telling the nature of collection, which means here, the samples, the types are very important. MSU, first monitoring, random. Why we do this, what we are seeing it. As a technician, we have to know. And then when it comes to testing, what are the methods that we can collect for testing? We should know. Yes, Christiana.
Yes, miss. I wanted to go back with, you said in case if, let's say, the fridge wasn't working, for the urine sample, what preservative could we use? Was it something acid? I didn't get the first part.
Boric acid. Boric acid is a common one because, yeah,
Okay.
it doesn't interfere with, there are so many. But what I have learned, this doesn't interfere with the test results that much, except leaving some residue. But that's okay, manageable. There are other things, you know, the labs, they have their own protocols. This comes under the standard operating procedure of a lab. The lab where you're going to step in or where you'll be hired, if it's a hospital lab, they may have a different method, different preservative. If it is for the, I know generally the hospital labs, they use the boric acid. Commonly, they use a boric acid because boric acid doesn't interfere with the tests. But some chemicals, they can after a certain period of time. There's a big table. You don't have to memorize. Just, I mentioned that as an example.
Okay.
So the different labs, they use it. You're most welcome. It depends on the protocol of the lab, the standard operating procedure of the lab. Clear?
Yes, clear. Thank you.
And this, well, you're most welcome. And this 24-hour must, you should know why a 24-hour urine is collected. What's the purpose? These are all MLPAW questions as well. When it comes to urine, it's a special thing, everything you should know as a technician. Catheter, yes, when you're working in the hospital, you have to know because you'll be involved with this. And suprapubic, yes, you have to know. So these are very important. Okay, you may get a question, which is the most invasive collection of urine? What will be your answer? Invasive method of urine collection. Suprapubic. Very good. Good job. Why do we collect the 24-hour urine?
Test the integrity of the
chemicals. There will be one option to see the chemicals or chemical nature of the urine. If they don't use the word chemical, enzymes and hormones will be there. Sometimes they give a collection of chemicals, enzymes, hormones, drugs. Check mark. Clear? But you should know how to answer these things. We have 2 minutes for the break. Come from the break. We'll complete this. It's a very important topic. And after that, we'll start the revision. Today, I'll pull someone asked for the crossword puzzle. So I can do the crossword puzzle tomorrow, but today we'll continue with the different. I'll give you the important topics that you have to focus more for the final exam. Yes, Varna?
Ma'am, I have a question. Aside from drawing bloods being a phlebotomist, do we also do the urine test and stool test?
It's our job.
Oh, I see. Okay. Thank you.
Your job is not to find the results. Your job is giving the patient the instructions. They will come to you. As a technician, you'll be there in the lab, in the collection center. You'll open the requisition, and then you know there is something microbiology urine has been just circled or check marked. Immediately, which type of collection you will insist? It's a good thing you brought this. Okay. Which type of collection you have to do if it's in the micro? Just now we studied?
Urine.
Swab.
Okay.
Specimen.
Type of collection.
24.
24.
What was the
Random.
question, Miss?
Oh,
Can you
the
repeat the question?
random.
I'll
Random.
repeat the question. A patient is bringing the requisition to you. You open the requisition and you find there is a microbiology section. In that microbiology section, the urine has been check marked. Now, what will be the instruction as a technician that you have to give it to the patient? How should they collect the urine?
MSU.
I think the
MSU.
MSU, because this is for the infection. It's micro.
Mm.
If a patient is bringing the requisition and it says 24-hour urine, so what instructions will you give? Or sometimes not 24 hours. Just they will check for the chemicals or drugs in the chemistry.
24 hours.
Which type of instruction will you give and what will you give?
The first
24
morning.
hours.
First morning.
First morning you give, yes.
Yeah.
But when it comes to the urine, under the urinalysis, they want to, there is a check mark for drugs.
I got it.
That's 24 hours.
24 hours.
That's it.
Very good. Just there will be a check mark for random. What will you give? Just a sterile container. Tell them just bring the urine. That's it. Check for the check marks in the requisition. So as a technician, you have to know this. For example, in the chemistry, there'll be catecholamine, something in the requisition. If the catecholamine has been checked, it means give the 24-hour container. Generally, for the enzymes, it has been checked in the chemistry. Give them just a sterile container. Tell them the first morning, tomorrow morning, drop it. Because first morning, they won't come there to just give the urine. They can collect it at home and drop it immediately within 2 hours. What if it exceeds 2 hours? Keep it in the fridge and drop it. Now, as a technician, if you are receiving that, check the requisition, take the time, document it. When that has been given, what's the reason? You have to document. Clear? If nothing has been checked, just random urine has been checked, give them just a container, tell bring the urine. So now it will be like, oh my God, these are too many things. But once when you start practicing, easy for you. It's not a big deal. And the suprapubic and catheter is not your business. As generally a technician, this is in the hospital. You don't have to worry. In general, as a technician, you may be dealing with the 24 hours, MSU, what do you call the first morning, random. But catheter and suprapubic, it will be in the hospital. If you are working as a technician in the hospital, you will collect urine like this. This is mainly the nurses will do you don't have to inject in the bladder. It's not your job. Except the blood collection, no invasive procedure is allowed. It doesn't come under the scope of practice as a lab technician, period. Clear?
Yeah.
All of you?
Yes, ma'am, clear.
Yes,
Thank
ma'am,
you.
clear.
Okay, have a nice break. See you at 11:30 exactly,
Yes,
because we
thank
have to
you.
cover
Okay.
important topics. And then I'll give you the topics that you have to focus more for the final exam, which this urine part is important too. So we will talk about it. We'll discuss as a revision. And tomorrow for 4 hours, there'll be complete revision. And then you have more time for writing the exam. So good luck. Okay.
Thank you, ma'am.
Thank
See you
you.
after the break. Okay. Good job.
Okay, thank you.
What time are we coming back?
Thank you.
Welcome back, Eveline.
Yes, ma'am. Thank
Apparatus.
you.
Yes, ma'am.
Shabana is awake. Hey, good job. Alpinet, good job. So who's here?
I think most of us are here, I think.
Let me take a quick attendance. Okay. Okay, good. Okay, Kara, thank you. Quick attendance, Alexia. Alexia, good.
Present.
Amina, yes. Alcinet, yes. Christiana,
Yes, I'm present.
okay. Chris, Sarina,
Here.
mine. Eveline, I can see Huda,
Yes.
Joanna, Kara, I know. Louis, yes. Maris,
Yes, ma'am.
Maris, yes. Very good. Rugiatu,
Yes, can you hear me?
yeah, I can hear you. Santiago,
Hi, Miss, I'm here.
good. I see Shabana, Berna.
Here, ma'am.
Berna, yeah, very good. Ing Hong, Yusra,
Yes, present.
Zenaida.
Hi, ma'am.
Hi. Okay. We are ready to start because we have to quickly finish this. We talked about the most sterile urine collection. When you're in hospital, like you will know about the suprapubic, and supra is generally considered superior. There's one explanation I want to give. Someone talked about the supracentesis. Centesis is a procedure where you insert the needle to collect something, to aspire something. But here, more specifically, this has been coined superior to the pubic bone. That's why they named this. Supra means superior. But the whole point is it's ultra sterile. Kara, can you hear me? It is ultra sterile,
Yes.
but at the same time, they are more specific to use the same suprapubic. Supra is, of course, superior, but here it's superior to the pubic bone as well. That's why they named this as a convenience, suprapubic. For the next one, types of stool samples and tests. Who will perform this as technician?
Well, the
As
patient
technician,
performs
the
it, but we
patient
test it.
yes, very good.
Yes.
Yeah, that's why I want to tell you what we have to do as a technician in this. We are not collecting, the patients will be collecting, bringing it along
Giving
with the requisition,
instructions.
giving the instructions. Very good. And we have to instruct them how to store or save the sample to avoid contamination. And we have to document it, and we have to prepare the station for the technologists to perform the job. Because there is a kit called the fecal occult blood test kit. We have it in the lab. It's you will learn this in the chemistry. When you learn the chemistry, it's there as a skill. You should know how to just prepare the station. But in the lab, in the life labs, in the core lab, we have a tube called the FIT tube. Okay, this is to detect the colon cancer. Just they have to collect the specimen, insert it in the tube, and then lock it. It locks. They bring and they drop the tube. That tube runs in the analyzer, and quickly they get the result. No manual testing is there in life labs. The Dynacare, they uses the manual testing kit. Just for your information. Now here also we have different type of tests and samples that we have to give instruction to the patient. When you have to check for the microbial activity in the stool, how will you instruct? If they're in the requisition, it's in the microbiology area. For the stool collection, it means they're looking for some bacteria. Shigella, Salmonella, this is the bacteria. E. coli bacteria can be there. Listeria
And
can be there. They cause infections, not the parasite. Parasite is something that's attached to release their eggs and everything. It's considered parasites, but not permanently. It's there. It's an infectious bacteria that enters when the immune system is weak. It settles in the digestive system, mainly causing diarrhea. It should be collected in a sterile container, and within 2 hours, this has to be cultured. Now, what do you understand by the term culture? So it says we're looking for a disease. Yes, the requisition says there should be a sample collection. We give the container to collect the sample. How will they collect the sample if it's a diarrhea? There is a procedure. There will be a paper where you're going to work. They will give you a paper where you have to tell the instructions as well as a technician, give the paper to them. There's a procedure of collecting that. I'm not going to go in detail. Just know that you have to give them the instructions, collect it, document it, and prepare the station for the technologists to see the result, not us. But can we tell the results to the patient? That's a big no, no, no.
No.
Big no. And what is culture within 2 hours? This is considered as within the scope of practice for us as a technician. It means when the sample comes in, there will be a Petri plate. Inside the Petri plate, there is a medium. Medium means it's a growth, growth media for the bacteria to grow. We have to prepare that and keep it in the incubator. Why? Because we want to see the bacteria growing. Then we have to make the slide, give it to the technologist. The technologist will sit and look at the microscope, and then they will find out what is the shape of the organism, what's happening. But of course, we have to stain for the bacteria. It's a gram negative, gram positive. This we will be doing the staining procedure and giving the slide to the technologist. So that's what we have. It says we have to do this within 2 hours. We have to culture within 2 hours. It takes 24 hours for the bacteria to grow. So the results will be released after 1 day. But this culture preparation to be kept inside the incubator is a major job when you're there in the microbiology that is done by the technician. So when you're going to learn microbiology, if I'm there, I will teach you how we do this. Clear? Fecal fats. What does this fecal fats means? Fecal fat means excessive fat and is coming out in feces. Now, why there's an excessive fat? That could be a problem concerning with the fat content, and it's released in the stool, or they are eating some special diet, so they want to check something. And 3 days consecutively, you have to tell the patient to collect the sample for 3 days. Who will provide the instruction? You. Based on what? Based on the requisition that you are receiving. And now this patient have to collect the 3-day sample and they have to freeze it. For 3 days, they freeze this feces and then they will put it in the freezer and then they have to bring it. This is like a yucky process. When it comes to children, they say yucky, right? So it's a big no, but they have to do because they have to look for something in the feces for testing. This is another thing, ova and parasite. Now, mainly they come under, this topic comes under the parasitology, to be more specific. In some countries, in developing countries especially, the children are playing in the soil. They don't wash their hands. There'll be dry eggs in the soil, which is inactive. And they don't wash their hands and then they eat something. And now this eggs, they get attached to whatever you're eating because they never wash their hands. Now this enters, stay there for 15 days or more, depending on their life cycle. The worms, mainly the worms, they will grow inside the stomach. Now they cause some sort of discomfort. The children, no, whatever they are eating, the germs inside, the parasites will eat. And this parasites will lay eggs after eggs. Part of that will be coming in the feces. to check. Now this children will become mainly for the children, even for adults, but mainly this is for the children. The children will be very skinny. The stomach will be a little bit big. They'll be eating and eating. They're hungry because the parasites are eating inside. Now the doctors wants to know what is exactly happening. Then they have to go for this. And they are collected in a preservative called SAF. It is SAF is an important ML Power question, final exam question, everything. SAF. What is the SAF? SAF is a preservative. What is the full form of SAF? The full form of SAF is sodium acetate, acetic acid, formalin. I'm repeating this. Sodium acetate, acetic acid, formalin. You have to put that in a container and give it to them to collect the sample. This can stay at room temperature, and this can be delivered to the lab within 72 hours, which means 2 to 3 days. Clear? Why it should be in the room temperature? What will happen if it's in the fridge? It will die. Or the eggs may not show the proper results, what they're looking for. That's why put the preservative and then maintain it in the room temperature. Pinworm. This is another type of parasite. It lays eggs. It's in the form of a pin shape. I mean, very tiny, minute. Okay, this comes early in the morning to hatch eggs in the anal area, the worms. Yeah. And what they do, we have this, the sticky paddle. I'll show it to you when it comes to micro. So they will attach that, yes, they will attach that to the anal area, and then they will bring that paper or sheet to the lab. Okay?
Scotch tape method, ma'am.
Scotch tape method is a different one, but there is a sticky paddle method. We have to collect it.
Oh, okay.
There's a container with a paddle also. There's a container with a paddle. I'll show it to you. So this has to be kept inside the fridge. Why? This can withstand that thing. And then it can be brought to the lab in 48 hours. Fecal occult blood. This is the blood coming in stool. It can be due to colon cancer. So this is a best screening procedure for the colon cancer. And this is what the Life Lab has introduced, a tube-like thing, a flat tube. From the container, they will put it in the flat tube. It's a beautiful small tube. I will show it to you when you're doing the chemistry. And that goes directly into an analyzer, and the results will be printed if it's a cancer, it's positive or negative. Okay? There'll be minute amounts of blood in the stool. So they will collect it repeatedly, multiple times to confirm. And this is a fecal immunochemical test. This is the FIT test, actually. This is the one it's an alternate test for FOBT where the Life Labs is handling. This is the FIT tube. Fecal immunochemical test. Yes, Eveline?
Is this now the test, ma'am, that it's collected for blood collection?
Yeah, not blood collection. When you are a technician, based on the requisition, you have to follow these steps. If it is mentioned there in the requisition, then it's your duty to give them the instruction and tell them to collect and bring it.
Oh, okay. Yeah, because as I understand, there's already the new collection aside from the FOBT. Yeah, for colorectal cancer.
Cancer, yeah, that's for this one, the red box here, colorectal cancer screening test.
Okay, thank you.
One lab, in majority of the labs, they use the fecal occult blood. There is one cardboard that we have to apply the feces, and then there'll be a color change. You have to prepare the station. But this is a fecal immunochemical test. It's like quick. It's not messy, but because here you have to wear the gloves, you have to pick the fecal matter, apply it on the cardboard, and then you prepare the station for the technologists to observe. It's messy. The FIT test is very decent. The patient can put that inside the tube and then clean it and bring it to the lab. You label it and then put it in the analyzer, or you have to label and give the tube so that they can insert it and bring it. You put it in the analyzer, press the button, and the results are printed. Very cool, this one. I like the fit test. How will you handle for the stool? Now, what is the name of the preservative? Short form. Fecal preservation.
SAP.
SAP. What is the full form?
Sodium acetate,
acetic
acetic
acid
formalin.
Good, very good. That's it. Good job. Now, how will you handle the stool specimens? Patient have to collect. We have nothing to do in the collection. Only blood collection is enough for us. They have to bring the urine. They have to bring the fecal matter. Label. The labeling here, see, for the patient identification. Labeling is important. Instructions should be given only by us. The doctors will not give, the nurses won't give. We are involved here, so it's important. Verbal and written. We talk to them and give the letter. Letter in the sense, it cannot be considered a letter. It's a document giving the instructions what to do. And the patient, and you document it, that at this time, you have given this based on the requisition. The next day, they will bring it and drop it. You pick the requisition, document it. It's been dropped within 48 hours, within 72 hours, within 2 hours, whatever you have to write, you have to document. It's important, and you have to initial. And if there is a preservative, you have to talk about the preservative. See, there is a preservative inside. You don't have to give a brief lecture. It is a sodium acetate, acetic acid, formalin. They will panic. Oh my God, I'm having something, and they are giving big chemicals to store. So commonly, they have no idea. So just tell them there is a preservative. That's it. Clear? And if something doesn't have a preservative, tell them just bring it. If there is a preservative, that could be to find something. There is a reason for that. So tell them there is a preservative. Please drop within this many hours. And as a technician, you should know what the doctor is expecting in that container, what they're going to test. If it is for the pinworms, how many hours, what instructions? If it is a FOBT, what instructions? If it is for FIT, what instructions? Everything is dealt by you. If it is regarding the, the microorganisms sitting inside and causing diarrhea, then for culture and sensitivity, give them the instructions. So all this should be done by you. Handling for semen specimens. This is mainly involved with other body fluid conditions. This is the sperms when they are not having viability. If someone is not getting pregnant, they want to check what's happening, whether the mobility is there, whether the viability is there, if they have energy. So all this, it comes mainly in the fertility clinic. There, if someone is working, then they have to check. They should know how to collect, tell them what should be done. All this thing come under that. Give them the container and clean containers, and it should be fresh and should be tested immediately within 1 hour. And the temperature should be 20 degrees to 37 degrees, so normal body temperature. If something excess heat is there, then the results won't be accurate. If it's below the temperature, below 20, then it's not like the viability, you cannot test. Instructions for collection include avoiding ejaculation. So this you have to, as per the Dynacare and Life Labs, wherever you are going to work, you give them the instructions how to collect. If you're not comfortable giving them the instructions, give them the paper. There will be a paper that it's been given to them. And this is a very important thing. We talked about the scrapings. I talked to you about the fungal infections. Yes, North America is more prone to fungal infections. Reason I mentioned. What is the reason?
Temperature.
Weather. Good job. Even at home, you better clean the windows, the washroom sink areas, because you can see the fungal spores. Sometimes we don't, because the the heating. You have to have a humidifier. There is a procedure of dehumidifier and humidifier. You should know when to fix the, or when you have to attach the dehumidifier, when do you have to have a humidifier at home? But the reason is there are water droplets that are collected into the heating. So I think we use the dehumidifiers in case of the heating is there. So what does dehumidifiers do? The excess water that's been accumulated in the form of droplets has to be like taken out. They're using special filters.
Yeah, the
It
moisture.
removes the
The
moisture.
moisture. The
Right.
reason why we insist this, why we make this as a must, because to avoid the fungal infections. One spore on the skin can make wonders in a bad way. You can see the lesions, you can see the black spots, you can see always redness and itchy. We don't know which type of fungus is sitting there causing this much trouble. And the one thing with the fungus, they don't go away easily. Virus has a time. Virus is there for 1 week, and then for the cold, for example, it goes. Anyways, it goes. Bacteria, if it's given the proper treatment, bacteria doesn't want to leave us either. But if you give the proper antibiotics, you can eliminate. But this fungus is the one that doesn't listen to the antibiotics that's given to the bacteria to eradicate bacteria. This needs a special chemical compound to arrest the growth. This is a topic that I would like to talk. I love this because this has been my specialization when I studied my bachelor. Amazing. Fungus can destroy a bone. Fungus can destroy a nail. Fungus can destroy a skin. Fungus can destroy a lung system. They are that powerful and they don't go away easily. There is a fungus called Aspergillus species. They will be inside your lung system, sitting there comfortably, and the symptoms will be exactly same as the tuberculosis. In those days, people thought it's a tuberculosis. Later on, thanks to the scanning, x-rays and everything, they can see beautifully how they make the spores inside and how they come out and what causes them to make those phlegm, like the tuberculosis and all this. Amazing. That's why we have to be very careful when it comes to fungus. Mainly with the skin infections, yes, there are more skin infections here in this North American continent because of the weather. Fungus is a thing that needs little moisture, little energy, giving something that can multiply. So the best thing is use the bleach, the best example, if it's not a metallic surface, prepare the 1% dilute bleach even at home, just apply it, and then once in a week or twice a week, just remove that because that can kill this fungal spores. I do that at home because I cannot stand the spores of the fungus because I know about them. And it makes me feel really, really scary. I don't want any skin to be damaged. It's itchy. I think once I got it, I was doing some practicals in the micro back home. Accidentally, I was like, I touched somewhere here, I think with the gloves or something. It started, there's a red spot, itchy, and it never went up until 1 week. I have to suffer with that. It's either I am sensitive or psychologically, but this is a fact. Fungus can damage your skin. That's why they want to go to the doctor. The doctor will insist like scrape. They have to bring the fungal scrapings. I mean the skin scrapings to check the fungal infection. What is actually happening? Some people have the toe nails infected with the fungus. It doesn't go away easily. Okay, there is a term for that specific term. It's called some. Mainly the toenails will be damaged. It eats the nail, the fungus. I'll check for the term. I'm forgetting. It starts with some ornitho, something like that. I'm forgetting. But it doesn't go away easily, and slowly it will be settled inside, eating slowly everything, the nail. Is it clear? So what you have to do, the main thing, if you happen to see there is something for the micro for the fungal thing, give the black paper and an envelope to them. So they have to scrape the skin area gently, and then the tissue, whatever is falling, like the dead tissue, you have to collect it in the envelope and keep it in a black paper because they will grow inside, or just not exactly growing, I would say, because it's a dry skin, just to protect it from other moisture or any other light, something like that. Because, you know, the light can arrest the growth of the fungus. We are not getting the direct light here. This way the fungus multiply. In other tropical weathers, this will not multiply or grow as it grows here in North America. Okay, clear?
So
Okay.
the
Yes,
patient,
ma'am.
the patient is the one who do the scrape.
Yeah, we don't scrape. They have to
Okay.
scrape because they are sensitive. Like they know how to, but yes, there'll be an instruction provided in the paper. We can give the instruction, but it's gentle scraping. Just be
Okay.
sleep, get up, there'll be the deposit of that skin that they're going to collect it. That's it. But gently they will scrape it.
Okay.
That's
Ma'am,
enough to test.
Yes, you're probably talking about the athlete's foot. Fungal infection of the athlete's foot.
That's one type.
Yeah, Tinea.
There is the toenail fungus. I'll find the name. It's a toenail
okay.
fungus.
Yeah.
It's, I don't know, people, they have different type of fungal infections. When you see that, you will hate fungus. I'm telling you, bacteria, viruses are better than fungus. Fungus are so bad. So legal specimens. Up to this, everything is clear, but you have to go through the slides, okay? After going, what is this legal specimen? I'm repeating this. Legal procedure is a very important aspect when it comes to a lab technician. Why? There are complications because of taking drug abuse, one example, alcohol abuse. Why these people have to come there? For blood collection, of course. In the case of drug, urine collection. But the difference here in the urine collection and a normal patient is, in a normal patient, for the ID, you just ask their
name and
date of birth. That's it. But here you ask the ID, driver's license, or if there is any legal identification, a PR card, for example, if they don't have the driver's license. Why this is that critical? Because this is dealing with the police and the judge. If someone is caught using a drug and they suspect this drug, immediately they will bring it to you. The police will be accompanying them. And what you have to do, you don't ask, what is your first name? What is your last name? You just say, where is it? May I see your ID? That's why it's important. They will show the ID. Just check with the requisition. The doctor is there to give the requisition. This patient needs to be tested immediately for the drug. There is a POCT for drug testing also. But in case they want to know more specifically about which drug, so they may bring this patient. So you have to give them the instructions how to collect the urine. And you have this as a skill in the skill book. In the lab skill book, there is one chapter where you are going to talk about it. Clear? And there is a requisition. Along with the requisition, there is an extra form that will come to you. And this is the situation. That form is called the chain of custody form. And this is what you have to know. It is important. What is the chain of custody form? The chain of custody form, what does custody means? What's custody?
You have it in
Under
your
the
care.
protection.
Under someone's care.
Under someone's care.
Under someone's care. Now, when people are coming like this, they are now coming under someone's care. Who's that? The police. Throughout the procedure, the police will be there standing. You will be giving instruction. You will initial it. You will be asking for the ID. You will be documenting everything, but someone will be there. So that patient, whoever is coming, is taken care legally by some procedure. Who is that? That's the policeman who will be bringing him. Clear? This is the difference between the urine you're going to give the instruction to collect for something legally who is binded to and something who is normal. For a normal patient, you don't ask for an ID. No one will be accompanying them while giving the instructions. But in the case of chain of custody, what is chain of custody? Throughout, there will be a link of someone who is monitoring you.
A form that accompanies the sample.
Yeah.
Yeah, which
Till
are
the-
the police officers, right?
Till you sign, till you seal for transportation, the patient will be there, the police will be there. Clear?
Yes, clear.
Okay. Now, quickly, medico-legal specimen, what does this mean? Medically, someone has to perform something, but it's legal also. They are involved in some activity that's prohibited by law. That's why there's a legal procedure for the chain of, what is the legal procedure that they have violated? Drug, excessive alcohol. Some of them, they consume drugs and then they avoid the children. So those children are taken care by the Children Aid Society. Now, this person may argue with the Children Aid Society. No, like we are taking care, we don't do this, we don't. So now they want to know whether this person is lying or not lying. So they will bring them. So even in that case, they will be, because these are all the legal procedures. If the children goes to Children Aid Society, yes, legally they are binded by the court now. If the parents want to get the children back, they have to fight. Why? Child neglect, child abuse. It's happening. It's happening. That's why people come there for testing. We have drivers who take the goods, the carriers, they are caught for some drug or alcohol thing. Immediately, if there is a clinic, they are caught, then they get the requisition, they bring it to the lab, the collection center, mainly. You have to perform. When they come, they will come with a chain of custody form. This is an extra form that is attached and it will be performed under the care of the legally bounded person. Who is that? Police officer. That's why we call this medico-legal specimens. Now, in this case, what is the name of the extra form that is attached?
Chain of
Chain of
custody.
Chain of custody form. We have this to give instructions to the patient, what we expect, what we have to do, what we shouldn't do in your lab skill book. So when you're doing the urinalysis, after the urinalysis module, you will have a chemistry module. In this, you will have this in your lab skill book. So if I'm there, I will demo. Most probably if I'm there, I won't demo, I'll ask you questions. So you have to be ready to give the answers clearly. Specimen that can help with the legal case. One of the common tests is blood alcohols. People say they never consume alcohol, but now there are point of care testing once again for alcohol, but still they come to the collection centers to confirm. Blood alcohols can be legal or medical. Legal if the case is for driving under the influence. It's not acceptable because they may cause accidents. Even the person who's driving without any consumption of alcohol may be killed. It can be an important family person. We are hearing so many stories. So this is why this is legally prohibited to drink and drive. Medical, if the physician is trying to determine the cause of the patient's symptoms, is it a drug overdose, street drugs? We all know about the fentanyl deaths we are seeing in the news. Fentanyl is a type of drug which we're not supposed to take. Some people, they take it for different reasons, mental health issues again. So when they deny, when they are caught in a situation, and then when they deny, then we have to confirm. Or some people, they are not in their own senses. They are lying on the street. If a police officer picks him, brings to check for the overdose, then definitely it's our duty to collect the blood, or if it's for the urine, then we have to give them the instructions, everything. These samples will be stored separately from the routine lab samples. Make this as a point. Even after testing, may retain longer. Why? Because some of the drugs, they may be taking 2 or 3 different type of drugs. The doctor wants to check one by one, so you keep it inside. And for the blood alcohol collections, there are different type of alcohol combinations. Mainly the one that we are using is the isopropyl alcohol, right? In the lab, there are other alcohols based on the chemical combination and the way the alcohol is binded to the main group of, they are CH3. In this CH3, OH is attached, one H is removed, CH2OH. What is this? Ethyl alcohol. And then methanol. Again, CH2OH is, sorry, CH2OH is methanol, CH2CHOH is ethanol. So propanol is again 3 group of carbon hydrogen with the hydroxyl combined. So this is based on the chemical nature of the carbon, hydrogen, and oxygen. They are named. Acetone is a very simple form of chemical. Acetone belongs to ketone group with a double bonded. It has a double binding or double bond. When someone is chemistry, they will understand. So these show their own reactions in the body, but they are not good when it's consumed. Methanol can instantly kill a person. The others may cause some dizziness or some other thing, but the liver is eventually damaged. Do not use an alcohol swab or tincture of iodine to cleanse the arm. This is the instruction that we have to follow. We should know what are the chemicals. You don't have to study in detail about the chemical structure. I told this to make sure that there are chemical hydrogen-oxygen bonds. But when someone is coming there, the collection center, and you are there as a technician, you want to check the blood alcohol, because there will be a requisition, there will be a check mark for the alcohol to be tested. When you are going to do the phlebotomy, don't use the isopropyl alcohol or alcohol swab. There is one other thing called tincture of iodine, but in the lab, we have chlorhexidine. That is the chemical other than the isopropyl alcohol that you have to just use it as an antiseptic, because if you use the alcohol swab, even the trace amount of alcohol can interfere with the test results, and then the results will be altered. Use povidone iodine, benzalkonium chloride. This we have now in the lab in the form of a swab. Chlorhexidine, I have it in the form of a bottle. All these things can be used. If you don't have anything, just use simple soap and water to cleanse that area and then do the procedure. This, as a technician, you have to know. And legal blood alcohol, usually collected by police or RCMP. This is where you get which form? Name of the form?
Chain of custody.
Chain of custody. Very good. Don't forget this. Important question. And they use a sealed collection kit. They will test this. If you're asked to collect, if you are asked to collect, if they come to the lab, this sealed collection kit is the point of care to test the alcohol. But if they are coming to the lab, if they're bringing the patient, they will have a requisition or chain of custody form. You have to look for it. And what will you ask? Will you ask, yes, may I know your last name and first name, sir?
ID number.
ID number. No, just can I have your ID, please?
Okay.
And you match the ID. You don't talk to them because they won't be in a normal situation to talk. Sometimes some of them are very rude. I have just handled a couple of them like that. Very rude. So that's why the police is there. They will deny, or they will say, sometimes they're not in the proper mood. If they're with the drugs, oh my God. So what you have to do, simply be quiet. The police is there. They will take care of everything when they are like little bit aggressive or something. You do your procedure calmly. That's it. And because you're going to initial in the forms. You're the witness. Never use a kit that has already been opened. This is in the case of drug kit. We have this in the lab. I'll show you how your drug kit will look. Will require a chain of custody form to accompany the sample. Always, if it's medico-legal procedure, there will be a policeman associated with the chain of custody form. You have to document it. Now, these are the different kits that they are showing how to pack it. Of course, when it has to go to the testing lab, when you are in the collection center, you put it inside the biohazard bag and pack it and send it to the lab. Now, chain of custody form, they're talking about this again and again, a form that accompanies the sample. It is documentation. So even after collection, you initial it. This is going to the lab along with the sample. And there will be an initial who collected the sample, who witnessed the procedure, who transported the specimen. When you are doing the collection, you are the one who will be transporting the specimen. So it should be your initial. Who received the specimen for processing. So there in the core lab, I am in the core lab now. If I'm receiving this sample, I have to document it. I received this at this time, and this has the chain of custody form, and this has been collected for this name. Everything should be there. This is how a chain of custody form look like. It's very small. I'll just tell what the content are here in this. This is a very simple example of a chain of custody form from Fisher Scientific, a company that manufactures or that prints these forms. There are more detailed form to fill out and use in the hospital setting. Yes, I have seen the detailed form. Remember, it stays with the sample at all times. So wherever the sample is been collected, it will come with the police, with the patient, and then it will go to the lab with the sample. And wherever the sample is being tested, this will be with the sample. If it's stored, this will be with the sample. That is this important collection. We are part of it. Why? We document it. We are giving instructions for collection. We are identifying the patient. How will you identify? What's your first name, last name? No. Can I see your ID, please? That's it. You check, you verify already because the chain of custody form has it. The police will be printing it or writing it. There'll be something there. So you just double check and give them. You have to give them the instructions by giving a urine container, and then you tell them what to do. It's a big procedure. We'll be anyway studying this or learning this in the lab as a skill. And you have to document this in the lab skill book. So nothing to worry. So what is written in the chain of custody form? There is a meeting at 12:30. It's in 15 minutes. So I'll stop this and I'll ask questions. And within this 15 minutes, I'll tell the topic tomorrow what you have to come like prepared because there's going to be a review. It's received by the date, time. That's it. This is a chain of custody form received from, for example, from the Life Lab, received by the code testing lab, Life Lab. Date, for example, if it's today's date. If the time is at 11:30 a.m., write 11:30 a.m. Okay, so this is the chain of custody form. So any questions, any doubt if you have, please let me know regarding this and go through this. It's really, really important. Chain of custody, the whole thing, what we have learned today, just go through this. It will take at least 1 hour. That's good enough for you to revise because some questions will be from this. It's the recent one and it's an important one. Along with this, you have to prepare the previous one, whatever you have learned in the previous tests in the unit, for example, 13 to 15, right? Go through all those questions if you can recall what is there. For example, the questions that we revised before. I'll give one example. If there is, if the child is crying, what will be increased if you're doing the collection, WBC? Then if you do the punctures using the lancets, is it a recycling one? Is a one-time use? All those type of questions, whatever you have studied, you have to recall that, go through that. But this topic alone is very important. So tomorrow come prepared with this. And one more thing, while doing the collection of the blood specimens, you should know the military clock. What does that mean? The 24-hour clock. You may get a question. A patient came to the lab at 3:15. How will you convert this according to the military time? How will you convert?
What time?
15:15.
3:15. So 15:15. This is one question that you can expect. Not the exact same numbers. I mean, you should know how to convert it. That's what I mean. That's why while labeling in the tube, we recommend military time. Now make that as a habit. After collecting the blood, make that as a habit to document it on the label using a military clock. 24-hour clock. Don't write to 1:20 p.m. Instead, what you have to write?
13:20.
13:20. So you will get questions like this. And the balances, which one is critical measurement, which one is okay, and tearing, what is the tearing? You should know. And regarding the PPE, you should know donning, doffing, and what are the special methods of preserving the urine, types of collection. All these things are important. One second. I want to give specific instructions for you. So any questions, you can come up with the questions. And you should know what is edema, and again the parts of the what do you call the syringe, you should know. And what will happen if there is a fainting patient and then you are there going to collect. If it's a fainting patient, you don't just look for the ID. You have to get the help from the nurse. Pick that answer. That's the correct answer. Of course, we check the label, but here it's more important because what if the patient suddenly gains the consciousness and then he is resisting? He may get injured and you may go in anxiety and there'll be like a injury.
Okay,
so
you mean
some witnesses
drawing from an unconscious patient.
Pardon me?
You meant drawing from getting samples from an unconscious patient.
Unconscious patient, get the help from the nurse. If it's general identification, then the wristband. Keep this in mind. Don't confuse. You may lose marks. Okay, what is the consequence of milking the site following the capillary puncture? What will happen?
You can push out tissue fluid.
Contamination.
Contamination, tissue
tissue
fluid,
fluid.
hemolysis. Okay.
Hemolysis.
And what's the purpose of tying the tourniquet? What will increase if there is what do you call? If the tourniquet is there for a long period of time, you have to know.
Fetishing.
Concentration.
Yes, I have to talk to you about some things regarding the final exam. So this is the completion of the lab safety module. If you have any questions, tomorrow is Thursday, full-fledged revision. We're going to see the important aspects in detail, and then you can get more information if you want to. If you do this, the way you answer will be easy for you in picking the right answers, reading the questions, because it will be a practice for you. You'll be knowing exactly what they are asking for. Now, studying is not important. How to pick the answers, how to read the questions are also important when it comes to this course. So you should have a thorough knowledge what you're doing, what you're looking for, and what they are looking for, you have to know. That's why I want to make sure that this is happening in a proper way without wasting the time. And you will be surprised to see if there is no distraction in the lab, you'll be good in your skills. If there's no distraction in the class, when everyone is paying attention, it's easy for you when you sit and when you grab the book and when you learn. So this is what I wanted to do. So I think I have completed my part successfully. I hope you all you enjoyed with me. So tomorrow will be a complete revision day. And then the following, keep the papers with you on Friday. Yes, once again, I will be with you for discussing some important questions, but it's not for a long time. So I'll be giving you an early release so you can relax.
Thank
And
you.
next week will be taken care by Moon. So in the lab, and after that, I believe she'll give few days for you for the final exam, but you have to make sure you're ready, because the early you finish it, you can proceed with the hematology. And I have taught you the hematology skills as well, so it's nothing to worry until I'm back.
Thank you, ma'am.
You're good. Clear?
Yes, thank you so
Yeah.
much, ma'am.
Yes. So any
Thank you,
questions
ma'am.
regarding this or any clarification you want? Just one thing, go through the information that we have talked about today, because this is something that you have to know. It's very important. Tomorrow, I will be dealing with the final exam crossword puzzle as well. Okay. And one more thing, the papers that you have written and submitted, I will hand over this to Moon, so she will distribute this to you. The one that you submitted in the beginning. Clear?
Clear.
Yes,
So, but
ma'am,
the
clear.
papers that you have in your hand is good for you for revision. But apart from that, important topics we will review tomorrow. That's for sure. So you'll have more confidence when it comes to final exam. Okay?
Okay, ma'am. Thank you.
You're most welcome. And have a good evening. I have a meeting exactly at 12:30. Stay safe, all of you, and enjoy your day. Any questions? I can take questions. Today, go home, prepare these PowerPoints, the important topics, chain of custody, SAF, urine. Urine is important. And then everything, please, how you store, how you handle is important. Go through the topics. Tomorrow, completely revision. That's it. Okay?
Ma'am, we are already home. You said go home.
I mean, go relax.
Thank you, ma'am. Thank you for
Thank
the early
you.
release.
Yes. Okay. Thank you. Okay.
Thank you.
Tomorrow
Thank
we
you.
will
Thank
be.
you.
Thank you.
Yeah. Come prepared,
Take
all
care.
of you. Thank you for
Thank
Yes.
being here in
you.
the
See you
class.
Take care.
tomorrow.
Bye.
See you tomorrow.
Bye.
Bye.
Bye bye.
Tomorrow. Bye.
Have a nice evening. Bye.
Thank you. You too. Bye.
Bye.
Thank you. Bye.
Mm.